The first thing to recognize is that both of them confer a pretty amazing amount of immunity. We're seeing efficacy at around 95% after the second dose. So in that way, they're both very similar. The similarities are probably more than the differences between Pfizer and Moderna. If we end up talking about Johnson and Johnson, that's a slightly different sort of vaccine. But you're talking about neither one of these are live virus. So there's no live COVID virus. There's no risk of getting the infection from getting these vaccines. They're both mRNA vaccines, and we can talk about what that means. The symptoms side effects are very similar. They're a little bit more frequent than a flu vaccine, but maybe similar to a shingles vaccine for people who have had that. Both of these require 2 doses. One of them, Pfizer, is 3 weeks apart, and Moderna is 4 weeks apart. And as Eric was saying, we are making that second dose appointment as soon as you've completed your first dose. That's not a second line that people have to get into. And the state has been able to help us continue to respect those second appointments with consistency. One of the bigger differences between these two is that the Moderna vaccine doesn't require as low of a temperature for storage. That is a little bit more convenient, but both of them do require fairly significant cold, storage. And the reason for that is because the mRNA itself is just very, very unstable. And at temperatures above those freezing temperatures, the mRNA just breaks down, which is actually one of the reasons Dr. Faust was saying these are such safe vaccines, is because what's introduced into the body is just waiting to break down. So as soon as it does its job, it's quickly cleared away by the body. So, I think the side effects are very similar on these, and they both are very effective vaccines. And I think from the perspective of trying to choose, I think people should just be focused on getting whichever one they can get access to.